Good evening for some of you that may be in different time zones. Welcome, colleagues. I am Gloria Giraldo. I'm the Non-Communicable Diseases and Mental Health Advisor for this regional program coordination in the Caribbean. I'm delighted to welcome you to this very special launch of the introductory virtual course on the Better Care for NCDs initiative. This webinar has been organized by the Initiative on Integrating Communicable Diseases into Primary Healthcare, the Better Care for NCDs, from the Department of Non-Communicable Diseases and Mental Health of the Pan American Health Organization. This webinar is designed for the English-speaking audiences of our region, and very especially for our English-speaking Caribbean region. And now we have the great pleasure of welcoming the Pan American Health Organization Assistant Director, Dr. Rhonda Seeley Thomas, for her welcoming remarks. Dr. Seeley.
Thank you, Gloria. I want to recognize Dr. Anselm Hennis, the Department Director of the Non-Communicable Disease Department here at PAHO in Washington, D.C. I would like to recognize the honorable representatives of Ministries of Health, partners, stakeholders, colleagues. Ladies and gentlemen, good morning. It's a privilege to welcome you to the official launch of the English version of the introductory Better Care for Non-Communicable Diseases virtual course. As we all know, the increasing burden of non-communicable diseases, or NCDs, in the region of the Americas represents an urgent challenge for our health systems. Many countries continue to face persistent gaps in providing early detection, continuity of care, and quality services for NCDs, particularly at the first level of care. These challenges are exacerbated among those populations living in conditions of vulnerability. In the Caribbean specifically, these challenges have been recognized since the Port-of-Spain Declaration in 2007, which was reiterated at the 2023 Bridgetown Declaration on NCDs and Mental Health that clearly established the negative impact of NCDs on small island developing states, including on economic development and human capital. Tackling NCDs in our region is of the utmost priority. In recognition of this importance, the Pan American Health Organization, PAHO, launched the Better Care for NCDs initiative to accelerate the integration of NCD services into primary health care. This initiative promotes access to quality, effective, and people-centered models of care while strengthening the capacity of health authorities and healthcare teams to scale up comprehensive NCD interventions through concrete and country-led actions. As part of this initiative, PAHO has developed this introductory course on Better Care for NCDs, a 15-hour self-administered virtual training module that introduces the core principles, tools, and implementation approaches of the initiative. This course is part of the Better Care Learning Pathway, which now offers 18 courses in English through PAHO's Virtual Campus for Public Health. The learning pathway is designed to strengthen key competencies in NCD care, including clinical management, service organization, community engagement, and data and information management. This training strategy aligns well with the growing popularity of the virtual campus in the English-speaking Caribbean, which now boasts over 22,000 users, and we expect that this new course will increase the uptake of these available resources. Today's session will include a presentation of the Better Care for NCDs initiative and its learning strategy, followed by a panel discussion on reflections and regional perspectives on the initiative with representatives from the Ministry of Health of Grenada, the Healthy Caribbean Coalition, and the Caribbean Public Health Agency, CARPHA. These discussions will highlight how the initiative and its introductory virtual course can contribute to strengthening NCD implementation efforts across different national contexts. The Better Care for NCDs initiative underpins our shared commitment to transforming primary health care to deliver high quality and equitable care for all people living with NCDs throughout the Caribbean and the region of the Americas. I'm so pleased to see all of you and to give these opening remarks. And I want to thank you in advance for your active participation in this very important webinar. Thank you.
Thank you so much, Dr. Rhonda Seeley Thomas, our Assistant Director at PAHO, for those warm, welcoming remarks. Very important for the launching of this new course. Now we will move on to listening what this is all about. We have Dr. Jonas González Garcia, who is the Senior Advisor for the Better Care for NCDs from the Non-Communicable Disease and Mental Health Department here at PAHO, and he will walk us through what the excitement is about. And here we go. Please, Jonas.
Well, good morning, everyone, and thank you very much, Gloria, and for the remarks of Dr. Seeley Thomas. Let me check if he, please, before I move forward, if you can see the slides I'm sharing, I will use to support my comments. Yes?
Yes.
Perfect. So as Dr. Seeley Thomas clearly stated, the burden of NCDs on the reality of our societies is so strong that from the health sector, we really need to react and to accelerate action in order to have better outcomes, not only impacting mortality, but also, and very relevant, allowing people with NCDs to have better well-being, better health status. And this is why our director, Dr. Barbosa, we are close to 2 years now, launched in September 2023 this initiative, which its main purpose is to expand, to accelerate access, equitable access of integrated and comprehensive NCD services within primary healthcare. And to do so, 3 objectives were clearly defined to support that expanded access. First, to work with the national authorities, the national health authorities, in order to support them to scale up their plans of action, their programs that are focused on NCDs. And with this specific focus on strengthening primary healthcare level as the more efficient approach in order to move this agenda forward. But not only that, we also need to address the healthcare service delivery level to support the health teams, to support the networks, the facilities, in order to better use the resources they have available, but also to look for opportunities to address they have at the local level. And to do so, and to know where we are, and to know what are the challenges, how we are progressing, if we don't have data, if we don't have information, well, it will be very difficult to really accelerate and to have evidence that we are going in the good pathway. So this is why we need really to strengthen data collection and monitoring for NCDs. Oops. And this image, what we call the casita, the little house in-house, indeed tries to provide an overview of the main NCD services. But this is not like a casita that has strong boundaries, because the reality is that we need to support with the priorities of the countries, the priorities of the country, or the local context. So obviously, in every context, cardiovascular disease, diabetes and obesity, cancer, mostly cervical cancer, breast cancer, chronic respiratory diseases, and healthy lifestyles counseling is central, is core in order to advance this agenda. But many countries right now are saying, well, we need also to address mental health. This is why this is orienting us. We are providing support to that, but also learning from the reality of the countries in order to integrate and accelerate that action that makes sense to the reality of our patients, to the reality of our communities. And consistent with the objectives, the 3 objectives, working with the national authorities supporting the healthcare delivery service level, but also the information systems. 6 strategic areas have been defined. And together linked with those 6 strategic areas, I have to share with you what we are developing, we are sharing, we are looking for alliance to make available resources to accelerate action, learning from others. And that's the case of sharing how we can accelerate the scale up of initiatives at the country level, at the local context, first strategic area. How we address communities which are in conditions of higher vulnerability, having that central perspective of equity, community outreach. That's the second strategic area. Everything we do to do it based and informed, but evidence, strong evidence. All what we are investing contributes to aggregate value to accelerate action. We cannot move forward if we don't have our primary healthcare workforce really strength and support to do their work with a clear understanding of the central role of all the participants of health teams, all the profiles, from the doctor to the nurse to the community worker. If we have all of that, but we don't have the basic, the essential medicines and equipments that make things happen, we will lack a major component. So the fifth strategic area precisely focus on facilitating access to those resources which are so fundamental. And finally, as I stress, we need to monitor, to know where we are, to know how we progress. This is the sixth strategic area. Some considerations that are transversal to all these efforts. Prioritize an equity approach. On NCDs, the burden, the impact of inequity is really vocal. It has a very strong consequence precisely on those more vulnerable populations. In order to address that, having an understanding of is about having national programs, national initiatives, but how that does it translate to territorial planning, to make change at the local level, to make change with the patient. So that territorial planning, addressing those gaps in coverage, access, and quality is central. That precisely means working at national, subnational, and local expansion of service delivery. And it's not only working with primary healthcare centers. Primary healthcare centers is the focus, but understanding that they are the level which is more accessible, the more efficient, but in the context of integrated health services networks. So expand the capacities for coordination and continuity of services. And we are not building from scratch. I'm just sharing here about, probably most of you know very well, the HEARTS, because many times it's referred as the flags of the initiative, but also we have the work of, for example, in cervical cancer. But HEARTS has the strength that got together many of those components that I have been sharing, because we have clear clinical pathways to guide clinical decisions. There's a strong component on training, and that's available on our virtual campus now under the framework of the Better Care Learning Pathway. There is also the work on making those essential medicines and technologies available, and a strong focus with some room of improvement in some of the Caribbean English communities and countries and territories to improve the monitoring of how we are doing also with HEARTS, not only with the NCD general framework. So, but now and today we are launching the introductory course, as I would say, a really very good opportunity to accelerate action. And I will expand a bit more on why I say that. First, I want to share this English version has the background and the strength that was launched in Spanish in March 18. In just those few months, from March 18, we have now more than 20,000 certified participants in the training with very good comments about how that contributes to the understanding. And it's expanded on 25 countries of our region. This introductory course has a main focus to clarify, if it was not clear, which are, in order to move in an efficient way in primary health care with this agenda, which are the essential NCD services that should be in place to move forward. But the course not only do that. Indeed, the first component, the first aspect that the course address is that it provides the participants to understand their context, which are the global, the regional targets for each NCD, which is how is the conditions, and even there are possibilities to benchmark which the situation of primary healthcare capacity to address NCDs, and having a really holistic understanding of the problem, and providing the opportunity to assess where locally the country is set in that general framework. But obviously, if there is one aspect which is key for this offer, for this resource, is that it promotes the implementation of the Better Care initiative. As it goes in detail, it's a 15 hours virtual training course, self-administered, that goes through the different modules that go through each strategic area, sharing resources, sharing experiences, sharing reflections in a very dynamic way. It doesn't stop in that. It also helps the participants to identify at the local level which are the gaps, the strengths, but also the gaps, in order to impact, to accelerate in their local context better outcomes for NCDs. And finally, it's intended to drive action, to provide the opportunity to reflect as an individual that participates in the training program, but also as health teams. We expect not only one individual in one facility taking the course, but the teams taking the course, to discuss how we can address those gaps, how we can build alliances, how we can move forward with the agenda. Those are the aspects, the components that going through this training will enable the participants to have more skills, which is the target audience, and being very consistent with that, those aspects I'm discussing. Mostly health workers teams in primary health care, from the doctor to the nurses to the community health workers and even other professionals. Indeed, for the Spanish version, more than 70% of the participants are health team workers. But not only them, also we feel it's an opportunity for professionals who have responsibilities at the planning and coordination level, because it provides that holistic understanding of why we are stressing the relevance of this effort, and which are the resources that are available right now in our technical cooperations and by the other stakeholders that we can try to get together, with that idea of building networks from national, subnational, and local level, having a shared vision on the importance of moving this agenda forward. And this is only the introduction to the learning pathway, and I will go very quickly in that. The learning pathway is a structured learning journey entailing courses and webinars that are ordered in order to address precisely the needs for health teams and the needs for decision makers. getting together those different kinds of resources, but in a logic which is easy to navigate and which can adapt to the specific needs of each team, of each professional, with an understanding of the importance of interprofessional health teams. So if you deep dive into the learning pathway, you can explore the different competencies and how you can make and choose to make a stronger focus on the competencies which are more relevant to the participant of the team that is taking part of the training. Just to show very quickly how it shows what we are speaking about. For the learning pathway, the rationale suggests to start by the introductory course, but you can deep dive finally, if you are speaking about clinical competencies, so you can focus on tobacco interventions, alcohol, well, a huge number that is growing day after day of resources which are available on the virtual course. Indeed, we need to update constantly those numbers. And just to share from the regional perspective, since the moment of the launch of the initiative in 2023, September, more than 500,000 of certified participants have taken advantage of those resources. I'm closing, but just to highlight that why this course matter. Well, as I said, it is designed to strengthen capacities at all levels. It's focused on practical application in country contexts. It's thought in order to support a scale up through a structured training, connects with key tools and implementation resources. It's certified by the PAHO Virtual Campus. And indeed, it's an open window, an open door to explore more on the initiatives and dedicated web space on all available resources. Just very quickly, because I know I'm going out of time, but in that web dedicated space of the initiative, you can deep dive into the dashboard of the initiative. You can go through the offer we have regarding the regional revolving funds to facilitate access to essential medicines and technologies, focus on projects as HOTS, with a lot of room of improvement in order to take advantage of those resources, a strong impact on vaccines, but so much room in other areas of the Better Care initiative. And finally, I invite you, we don't have time now, to just to view this short video in our web page, 3 minutes video that really goes in a, I think, very like a nice way through those components I have just shared with you. Thank you very much.
Thank you so much, Jonas, for giving us that very thorough overview of the initiative itself. We've also added on the chat the website, and also my colleagues just added the very short and succinct video that will give you in a very few minutes the overview. We will be sharing all materials, as well as thank you for the question on the Q&A. They are the PowerPoints can also be shared, but everything we're sharing has also been uploaded into our website, and this webinar will also be the recording available. So thank you, Jonas. We really see the Better Care for NCDs as a transformative initiative, spearheaded by the HEARTS initiative, building upon the work and in adding all the areas of work, because we know we're patient-centered and that we want to not only the patient, but the families and the communities in our countries to be well served. So without further delay, we also have invited a wonderful panel that will share from each of their perspectives in the Caribbean their remarks and their views on this new tool that is being launched today. So we are accompanied by our colleague representing the Ministry of Health Grenada, Dr. Annette McLeish. We're also represented, we have as a representative of the Civil Society sector and also academia, Dr. Kenneth Connell, and I will detail a bit more about their bio in a second. And we're joined by Dr. Heather Armstrong from the Caribbean Public Health Agency. So we have a diverse set of views, and let's get started with our panel. We will start with Dr. Annette McLeish, who is our Senior Medical Officer for Chronic Non-Communicable Diseases for the Ministry of Health of Grenada. And our question to our panelists will be simple. We want them to express their views, to give them a few minutes to do so. And the question is simple. We would like you to share, Dr. McLeish and colleagues, how this new course that is being launched today on the Better Care for NCDs aligns with the work that the Ministry of Grenada has already engaged on. Please, Dr. McLeish.
Good morning and thank you. I am pleased to represent Grenada in providing you an insight into how the Better Care for NCD initiative will be affecting our country. As a small island developing state in the Caribbean, Grenada continues to grapple with the high burden of non-communicable disease, including hypertension, diabetes, cardiovascular disease, cancer, and respiratory diseases. These conditions represent the leading cause of morbidity and mortality in our population and place a growing strain on our health system and national development. The contribution of factors like limited healthcare infrastructure, which include accessing essential medicines, diagnostic tools, and trained healthcare professionals, lifestyle changes, such as tobacco use, alcohol consumption, unhealthy diets, and decreased physical activity, environmental and social determinants. Our geographic location exposes us to hurricane and Sahara dust, now worsened by the effects of climate change. Our policies and prevention gap needing intervention like PAHO's HARTS initiative, policy enforcement, taxation on unhealthy products, and public health campaigns. Thus, the Better Care for NCD course, with its objectives of strengthening the capacity of health authorities to plan, manage, and implement comprehensive NCD services within the primary healthcare system, increasing the delivery of high-quality NCD screening, diagnosis, treatment, and continuous patient care at the primary healthcare level, including referrals and counter-referrals, and strengthening the NCD data collection to track, diagnose, treatment, and care outcomes will be impactful. From the ministry's perspective, the launch of PAHO's virtual course on Better Care for NCDs comes at a critical time, and we see it as a timely and strategic tool that aligns well with our current NCD response efforts. So how does it align with Grenada's NCD strategy? The course supports our strategic focus on strengthening primary health care as a foundation for equitable, continuous, and patient-centered NCD and self-management. It will also help providers to deliver better health care. One of our challenges has been ensuring consistent training and skills upgrading for healthcare providers. With providers from diverse systems and backgrounds, it is important to provide standardized care using evidence-based guidelines and protocols. This course provides a flexible, standardized, and accessible learning platform to train new and existing staff, to train HARTS implementation teams, to train our nurses and allied health professionals taking on expanded roles in task sharing. Secondly, scaling up Hearts in the America Initiative. Grenada implemented Hearts Initiative February 2025 under Dr. Renault's supervision to improve cardiovascular health. This course directly supports the efforts by reinforcing clinical protocol for hypertension and diabetes, team-based approaches, and the use of monitoring tools and treatment algorithms as it aimed to help country to assess their performance against national and WHO standards. The course focuses on early detection, risk stratification, continuity of care, and patient empowerment, all of which are essential to reducing complications and improving outcome. Currently, the ministry is developing a cancer registry, which once implemented will be used as a model for the other NCD registries, allowing for the estimation of prevalence and burden of NCDs. Similarly, addressing major gaps in health services data using innovative and digital technologies. With limited resources for in-person training, the virtual format allows for cost-effective, accessible, self-paced learning to upgrade our knowledge in line with global best practices without disrupting clinical services. In conclusion, PAHO's virtual course serve as a critical enabler to Grenada's national vision for integrated, high quality and sustainable NCD care within primary health systems. It reinforces our direction, strengthens our human resource base, and equips us with practical tools to accelerate our progress towards healthier communities and a reduced NCD burden. We welcome this course as a partner in our ongoing efforts and encourage our healthcare providers to take full advantage of this opportunity. Thank you.
Thank you so much, Dr. McLeish, because it truly is the purpose of our work, that this new tool makes sense, that this new tool can be employed and aligned with current efforts. Thank you for highlighting the work in Grenada, not only of the Hearts Initiative, but many other, as you well described, of the other facets of the work and the rationale of why this is useful. So let us then move on to a perspective from Dr. Kenneth Connell, who is a very active person in the Caribbean in the health space. So he represents, as president, the Healthy Caribbean Coalition, our very important civil society organization that represents and works closely with many of the other, with many civil society organizations around the Caribbean. And he's also with the Faculty of Medical Sciences at the University of West Indies in the Cave Hill campus. Dr. Connell, very similarly, but from your standpoint and your perspective, how does this new tool come in to align or be complementary to the work in NCDs, both of HCC and also your perspective from an academic view? Thank you.
Sure. Thanks, Gloria. And let me just start by saying how excited I am to be on this webinar. And you know this, but congratulations to the PAHO team for what I think is an important product to your virtual campus. And those of you who haven't visited a virtual campus should do so, even if it's not only to look at the better care for NCDs. I want to really address my comments from a practical standpoint, and I'm going to first leverage my academic hat and perhaps borrow on some questions posed by my own students who are medical students and also internal medicine residents in training. I must declare a bias, which is not really a bad bias in this setting. I was part of the evolution of Hearts, which started right here in Barbados as the standardized hypertension treatment protocol, and of course expanded massively into hearts. So here are two questions I want the audience to consider as I make the case for the fact that perhaps we are not doing things as good as we could, and that there are identifiable gaps that even a fourth or fifth year medical student could identify. The first question was posed at the end of a ward round because the team is on call. We've seen all these cases coming into the emergency room, and we've just seen what would have been the third stroke in less than 50 years old. So I'm going to let that data stick with you, right? Third stroke, patient less than 50. In all the cases, and I know Anselm Hennis is on here, so N is only equals to 3, but non-adherence. Non-adherence of medication. So these are people who were prescribed appropriate drugs, but just were non-adherent with medication. And so as a student was presenting the case, I suppose it would have been easy for her to say, you know, stroke secondary to uncontrolled hypertension or diabetes, uh, secondary to non-adherence of medication. But interestingly, the student went a bit further by saying possibly secondary to some of the social determinants for non-adherence. And I think that stuck with me because many of you on the call who are doctors would know, usually in the social history, you just kind of state what are the risk factors. Here's a student trying to make the point that perhaps there are social determinants for those risk factors that we as an acute medicine team should consider. So that's one question. The second question was again on another ward round, and this time again a fifth year medical student, no, an intern who looked at the third case on the ward, and I can use examples at the Queen Elizabeth Hospital here in Barbados of heart failure. Now, this is only his second week in medicine. He's now getting accustomed to the ward rounds, but what has struck him is the significant burden of heart failure in our hospital. And so the question asked was, or the statement made was, we are not getting things right. So two important things. One, a question, what are the social determinants for non-adherence? And the second point, we are not getting things right. And this occurred in the setting of me reviewing the Better Care for NCDs package. And I clearly identified that perhaps there are two gaps occurring. There are probably several other gaps, but two major gaps occurring. One, there appears to be a disconnect between what is happening in the tertiary care as we see patients coming in with events as a result of non-communicable diseases and what is happening at primary care. And I know Heather is on the call. This disconnect is not new, but even guilty as an educator in an internal medicine rotation, I don't focus in on the primary care elements. I leave it to my family medicine colleagues. Is this the correct way of teaching? That could be argued here in this course. The second thing is there disconnect between public health, which is taught at the undergraduate level, and students really enjoy the public health rotation. They get to go out there in the community and they get to see the impact of community on health. Is there disconnect between the social determinants they have identified in the community and public health when they come to hospital or even primary care medicine? And my argument to you is that there certainly is. There is a disconnect. And remember, these are future healthcare practitioners. It could have been a nursing student, could have been a pharmacy student. We have those as well on our ward round who don't seem to be able to connect as a result of these gaps. Whenever gaps occur, the balls can be dropped at each gap. And so therefore, the Better Care for NCDs allows for a holistic approach. I like the term used by Honus, and that is saying, what is the context? What is the context for this patient you're seeing in the emergency room? What is the context for the patient you're seeing in primary care? What is the context for the community outreach project that civil society is engaged in? What is the context within the country? This needs to be identified first before we can kind of say we're addressing the NCD burden, the NCD events. And once you've identified the context within country, the next step comes with hearts. And maybe perhaps I can bring in the civil society in input here as well. The HCC was kind of the managing association for the piloting of hearts and was really the civil society organization that really pushed hearts in its kind of implementation in Barbados, and now it has expanded. So there is a significant role for civil society in improving primary health care using a structured approach. Many of you on the call could say, well, is a structured approach critical? Remember, improving primary health care doesn't only involve improving the workforce. They need to train more doctors, perhaps more nurses and other healthcare facility, other practitioners. But it's important that these people can all do two things. One, they can understand the context, and two, they're all managing the NCDs on the same script. Hearts offered a script, a simplified script that perhaps even the patients can follow themselves in terms of the management of their hypertension in this case. The expanded hearts in its holistic way presented a roadmap for practitioners, whether you're in primary care, whether you're in tertiary care, whether you're a patient at home, a relative looking after a patient at home. It provided a roadmap for you to follow. Very simple. As we mentioned in terms of team-based care, there are transitions of care that occur. It is important, therefore, that the primary care doctor can follow the same script as the doctor admitting the patient or seeing the patient in the emergency room, and then on discharge can hand that script back over to the primary care doctor. So hearts allowed for that to occur, and I think this is probably one of the most critical interventions for the hearts package. The second argument that could be made is, how critical is it in cases where, or at times when the health service may be stretched or may not be functioning at its ideal? Now, we know from experience, all of us, that this occurred a few years ago during a pandemic when there was a lot of task shifting because people had to be doing other tasks. And of course, the agility of the health system was really tested. Again, having a structured approach like Hearts allowed people to pivot in different roles and to easily continue to follow the script. So I guess I will conclude here by saying when I look at the package for better care for NCDs, it allows through a continuous instructional design to see the context, to look at the interventions that will have impact on the individual patient, and finally, and this is not by any means the least of the three pillars, the capturing of data. Health systems have to be data driven. We have to monitor outcomes, and we need to adjust practices based on outcomes. And so the monitoring of data, of health data, is one such thing. I want to congratulate Pan American Health Organization. I want to throw a challenge out to PAHO as well, that perhaps you might consider the use of innovation more in the management of NCDs. For instance, remote monitoring of blood pressure, the use of big data models and predictive analytics to decide or to determine who is most susceptible to heart failure or cardiovascular events, all these sorts of things. Congratulations once again. I hope I have summarized both the academic and the civil society hats. I am excited to continue the course. I started it this weekend. I plan to continue. I also plan to make this highly recommended for our students here in the MBBS program. Thanks, Gloria, and over to you.
Thank you, Dr. Connell. Thank you for sharing those perspectives and bringing very also practical experiences. And this is exactly what we want to drive towards, that this becomes, it can only be transformative when it is adopted, when it is utilized. So just as you well described the journey with the Hearts Initiative and some of the practical tools it has offered, the Better Care for NCDs builds upon that foundation, and the Better Care for NCDs course also provides that ampler framework And we hope also in this learning pathway to continue providing tools. We're very excited also to see now our chat was disabled, but it is now able, it's now working and seeing the diversity of countries, even from continents, different continents that are joining us at the moment. Thank you. But we have our third panelist, and I love to hear from Dr. Heather Armstrong, who is the head of Chronic Disease and Injury Department from our main sub-regional partner, the Caribbean Public Health Agency. Therefore, please, Dr. Heather, share with us your thoughts and how this new course will align with the work that you do.
Thank you so much, Gloria. And I also want to say congratulations to the PAHO team. And as a regional public health agency, CARFA certainly welcomes the Better Care for NCDs course. We see it as timely and highly relevant to the work that we are engaged in across the Caribbean. And it brings to my mind the endorsement of the Caribbean Moves framework by the Caribbean Health Ministers in March of 2024. And while this framework sets a vision in terms of one of the pathways that we can use to reduce the burden of NCDs in our region, I would say that the Better Care for NCDs course somehow provides practical implementation tools that can help operationalize that vision at the primary care level. And certainly when I think about the priority areas and I link that to what is the content that is made available through this course, first of all, I see that it focuses on health system strengthening, which helps us to develop build resilient integrated care models that is to the benefit of our populations across our member states. And secondly, when we think of the workforce development and interprofessional training, again, we are building capacity for health teams to deliver, as was shared with us by Jonas, quality patient care and NCD care. Also, the emphasis on monitoring and surveillance, also mentioned by Dr. Connell, very important in us helping to make sure that our regional health intelligence is improved and ensuring that the data from our primary care facilities help feed into the national data and, of course, then to the regional surveillance platforms. And finally, it also supports community engagement, which complements our health promotion efforts across the Caribbean, on the Caribbean Moves and other initiatives, empowering persons to take greater ownership of their health. And that's something that we're looking forward to. Of course, when we consider that this course holds a lot of the key concepts together that are important in us being able to address the gaps that we know exist. And certainly, it supports regional coordination. And that's a core part of CARFA's mandate, where we work with partners, we work with entities to make a change within our region. Certainly, when I think of the Caribbean NCD Nutrition and Mental Health Focal Point Network, where we facilitate knowledge exchange across countries, this course allows for that exchange of knowledge. And again, as I said, to build capacity. Having shared frameworks, common indicators, and standardized approaches to reducing NCD in the region certainly enhances our discussions, allows for greater impact and alignment across countries and agencies, and supports our collective progress while allowing country-specific adaptation. So, as I see it, it enhances our ability to train or champions across the region, whether you are a healthcare provider or you are a decision maker. It helps to deepen our surveillance capacity, and it supports integrated service delivery. But I want to leave you with this thought, that with the Better Care for NCDs course, it offers us the opportunity to change the narrative. And as you would have heard, there is a need for that shift, where a diagnosis of diabetes in our region does not automatically mean blindness or other complications. And it doesn't rob our nationals of years of a productive life. And therefore, I would say it's not just a training program, but it can be seen as one of the platforms for regional transformation, one that already supports the work we at CARFA are doing. And of course, it also helps us to implement fully and together the change we need in order to change the trajectory of NCDs in the Caribbean. So I would encourage everyone to take the opportunity to really go through this course. And of course, as we get a better understanding of what we need to do to make a difference, I'm sure that we can really reduce the impact of NCDs across the Caribbean. Thank you.
Thank you so much, Dr. Armstrong. You couldn't have said it any better. I think your words really resonate with our audience. As I mentioned, extremely diverse of public health professionals throughout the Caribbean and throughout the world that are listening to this webinar and to this launch, which is barely a continuation of our work and the placing of this new tool. And we have a few minutes as we had planned. I'd love if the panelists could come up online. I'm going to take, I see a couple of questions. Others have been resolved, but I'd like to bring them up as well. There is a question from Dr. James Prater, who is at the School of Public Health, Yale Public School of Public Health. And I understand the question to refer to the limited human capital that we may have due to many different reasons. I know my colleagues from health services, systems and services are also joining us, listening to our conversation. And how, perhaps, if I'm reading correctly, the question, how this type of initiative and type of course can, help address this important issue we have in human capital limitation. So I'll start off maybe with Dr. Connell and a few words that we would want to end on time, but I want to take a couple of questions. Go ahead, Dr. Connell.
Sure. Thanks, James, for your question. So we do have an issue with human capital, but we are also experts at resilience, and we can leverage our expertise in the region to use the limited resources that we have to work better. Just as you have the best buys for NCDs, we can perhaps have the best treatment strategies for NCDs, using limited human resources, but working smarter and therefore working better. I think what Better Care for NCDs allows us to do is to contextualize so that we don't waste our resources the wrong places. And with the data and using data coming from the monitoring parts of Better Care, we can then see the impact we are having. If we're not having impact, we can re-strategize. So James, thanks for your question. I know we're going to discuss it a lot more, but let me just say that the Caribbean region and Latin America are the experts at resilience. And certainly we have a pandemic to prove that, right?
Thank you. Dr. Armstrong, Dr. McLeish, anything from your end?
To add to Dr. Collins. Oh, sorry. Go ahead, Dr. Go ahead.
Sure. So I support Dr. Connell's comment. Yes, we do have a problem with limited resources, but if those persons who are available are well educated and equipped to take care of the problems, then we could move forward.
Thank you. Dr. Armstrong?
I would just want to say I agree, noting that when we are shifting from a heavy based on specialist care, we're including the community, and there's community task shifting, where there's prevention as one of the main tools that we can use, meaning it helps us then to offset the heavy resources we need in terms of some areas. So I would say the course helps us to understand that, and if you can implement that, we'll find to some extent, not totally, it may address some of the human resource issues that we have.
Thank you. And yes, that is precisely the purpose, and also working towards the standardization of tools so that we're all aligned, and that facilitates that also those methodologies of task sharing, task shifting in our context. I will ask one more question because, and that will be the final, perhaps this is seems very directed to Dr. Connell from our, I believe is Dr. Yvonne Lewis, whom I'm not mistaken, maybe the Yvonne Lewis I'm thinking of from Trinidad and Tobago. If not, please forgive me. But the question on how the civil society it can contribute to this work on NCDs. And yeah, I'll let you go ahead and from your perspective as representing civil society as well.
Sure. I want to respond to this question by expanding it because it also covers a comment made by Colin Alert, who made the comment that in the private sector, primary care doctors are not part of a team. I think the first thing that the challenge we have is divorcing the traditional concept of teams and silo teams. So we're all part of one team. The doctor working in primary care is just as much a part of the team delivering care to the patient in hospital. So you call them up, right? The healthcare doctor in hospital has just as much responsibility for advocacy as the public health advocate out there. We are all part of the same holistic team. And what the challenges exist that how do we get closer together, perhaps using innovation and technology, so that we all can function as a more coherent team. Now, civil society organizations play an important role in strengthening the health system delivery as well. Let me use the example across the street, literally. There is no other cardiac rehabilitation in the country, the Heart and Stroke Foundation of Barbados, right? So civil society organizations support governments and administrations in providing valuable care services. They also play an important role in patient education and continued care. So this responsibility of the civil society organization is often overlooked. But think about it, Gloria. Those heart failure patients who don't get cardiac rehab are coming right back into the health system, right? At a faster rate. Those patients who don't get the correct education and support on diet and physical activity are going to represent. So there's a critical role for civil society.
Thank you, thank you. I think this what truly does is open and the discussion or allows us to continue a conversation that we have been having in the Caribbean. Therefore, we thank you for your presence, for your contributions, and in the spirit of trying to end on time as we wanted a very targeted launch, we are coming to a close. Thank you for your presence to the panelists, and now allow me to introduce Dr. Anselm Hennis, who is the Director of the Non-Communicable Diseases and Mental Health Department at the Pan American Health Organization, and he, of course, joins us from Washington, D.C. Please, Dr. Hennis.
Yes, thank you so much, Dr. Giraldo, and thanks so much, Dr. McLeish, Dr. Armstrong, and Dr. Connell. And I really appreciated those remarks and that really healthy and exciting dialogue. And I'm ready to thank also the organizers and to thank those who have participated. And I see there have been many comments as we've gone along. This engagement reflects a growing recognition about the importance of NCDs in the health arena in the region, and not just the importance due to its high morbidity and mortality, but also is one of the most urgent and growing problems facing health systems across the region. I will point out that the Caribbean sub-region, in the Declaration of Port of Spain in 2007, recognized the importance of NCDs to development and the economies of the sub-region. And this Declaration of Port of Spain was actually the first step in a journey towards the high-level meeting on NCDs in 2011. We approached the latest high-level meeting on NCDs and mental health, which takes place in New York at the United Nations General Assembly in September of this year. And we look forward to the leadership of the Caribbean sub-region, not just the leadership in terms of what they say, but in terms of what they continue to do. So as you've heard, the Better Care for NCDs initiative is at the center of PAHO's strategic response to this huge burden of non-communicable diseases. And this course is not only about technical guidance or isolated tools, but it is about playing a role in transforming how we deliver care for people living with NCDs. The whole idea of this initiative is to promote continuity, quality and equity at the first level of care. And why there? Because that is where the majority of treatment must take place. And if one is able to optimize the quality of care, one can reduce the preventable premature mortality from NCDs, which is as high as 38% in many of our countries. And this is deaths occurring between ages 30 and 70, and they're largely eminently preventable. So this course is just another tool to move countries from commitment to implementation. It's aimed at promoting evidence-based care models, as you've heard, and building capacity. We've had a significant response from the Latin American sub-region. So far, 20,500 plus persons have certified in this course. This course allows us to identify and to address gaps in quality of care, and it's all based on evidence-based care. And you heard also from our panelists, from Dr. Connell in particular, about the relevance of referral and counter-referral and the issue of social determinants of health. And as he spoke, I noted that yesterday we were on a call with Sir Michael Marmot, who is the global leader on social determinants of health. And as we pondered what he said we have to develop a course in this program on social determinants of health, because it makes no sense to treat people, given the context of where they've come from, and put them back into the same context, which does not support their health and well-being. So look out for a planned course in social determinants and health as well. So basically, we encourage also innovations, and that was suggested. And there are innovations in countries, for example, in Guyana, there's a large development in terms of telehealth and telemedicine. As you know, it's a large country with remote areas, and I think this also has to be part of the offer. The issue too of partnerships is going to be key to transforming health systems, and this again will be part of the process that we will be developing. So, as said by one of our very astute panelists, better care must be a platform for regional transformation. It must be the change we need to alter and to curb the trajectory of NCDs. So thank you one and all for your participation. We hope that you will all do the course, spread it widely, and help us as we develop stronger partnerships, stronger health systems, stronger approaches which are evidence-based to NCDs in the region, and that we can show our leadership by example. So thank you very much.
Thank you so much, Dr. Hannes. And I'm just so delighted because we've had such a engaged participants today. We had over 200, at some point 230 participants in a Friday in the Caribbean, where it's the end of the week and people have different activities in the middle of the day. So we thank you very much. We also thank the participants from other regions, from Bangladesh, from Nigeria, from other countries, which might be very different time zones. Thank you so much for joining us. We're very, very moved of all the countries, territories, fellow members here in the Caribbean. So with this, we have placed the link directly to the Better Care for NCDs course. Please join us by engaging with the course. Please be in communication with PAHO to your country offices to provide feedback. And we're delighted. Last thing, everybody who's participated, colleagues, if you can, the panelists could open the cameras, we take a quick picture and we will be done. Thank you so much. We really enjoyed this session, your questions, your insights. And let's take a quick picture, our collaborators, if they can do that. And we'll wish you a very healthy and safe weekend, and be in touch. Thank you from the Pan American Health Organization. Thank you so much. Have a great day. Bye-bye. Thank you. Thank you for joining us. Thanks. Thank you very much. Thank you. Wonderful comments coming through. Thank you. Very nice. Thank you to our panelists. Thank you.
Have I grabbed the photo yet, Gloria?
I think so. I mean, I
Okay.
was hoping my
Yes.
colleagues from communications would. Thank you. And thank you to all
Thanks,
our support
everyone.
staff.
Just
Thank you,
one more.
Anita.
Big smile, please.
Have a good weekend.
Yeah, same to you.
Thank
Thank you,
Thanks,
same
everyone.
to you.
Thank you.
Bye.
You too.
Bye-bye.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Bye, Gloria. Gusto en verte.
Thank you. Gracias.